Hello, my name is Kathy Hoover Miracle. I am our senior licensed clinician here at Family Service Association of Northeastern Pennsylvania, and I do our counseling with families or individuals or couples, children also, but typically more children that are adolescent age. Usually if someone's referred to the agency, a child for a specific issue, and they're 5 or 6 years old, they're usually under about 10 years old, they would probably be referred to Children's Service Center or the Child Advocacy Center, depending on what the issue is. Mainly I work with adults, but as I said, I also work with children. I also I do, as I said, couples and marital and individual and family. I will do groups if need be, which I've done in the past. And as well as those services, I also provide what we call EAP, Employee Assistance Service, counseling. And what that is a benefit that approximately at this point I have about maybe 40 employee assistance programs who refer their employees to our agency, and the employer will pick up, it depends on what EAP it is, but the employer, as a benefit to their employees, will pick up maybe their first, anywhere from probably 3 to, I would say, 8 sessions. And what will happen is I have direct EAPs that some employers will just call directly or have their staff call directly, and that person can just come and see me for counseling, whatever the issue is. Or we have, I have a few managed care EAPs, employee assistance programs, that the employer will go through the insurance and will do all the groundwork and will refer them to me that way. So in a nutshell, those are the services that the counseling department provides. And there are really only 2 kinds of situations where we don't feel it's appropriate for me to accept the case. One would be an employee or a person or anybody that is either actively suicidal or actively homicidal. The homicidal probably would need to see a psychiatrist or to be referred elsewhere. Unfortunately, we don't have a psychiatrist on staff, so we really can't accept those kinds of cases, for the benefit of the client, and also a client that is actively suicidal. And if someone calls in with a referral for someone that's actively suicidal, what we do tell them, however, is if they get medically cleared by either their physician, a psychiatrist, or a psychologist, then I can see them for counseling and hopefully, be able to work with them to resolve whatever problem exists. And the other other kinds of individuals that we are not equipped to take are individuals that are actively psychotic. At the time, if they are, hearing voices or, seeing things that aren't there, or maybe hearing voices in their head. Any kind of active psychosis, we would have to refer out. But just about anything else, as long as clients are willing to come into counseling, I certainly don't force anybody to. Some of my clients are court-ordered, but in that case, I work with the court to keep the court informed of our counseling experiences and services and how that's going. So in a nutshell, those are the services provided by the counseling department at Family Service Association. And if anybody would like more information about the program or would like to refer the program, they can contact the agency. Excuse me, they can ask for myself, Kathy Miracle, but I will probably at that point, I will have to refer them back to our intake coordinator, Karen Golova, and then Karen will work up the intake and schedule the client's first appointment with me. and after that, the client and I will just schedule. So I've been with the agency for a little bit over 30 years, have worked with all kinds of different families and individuals and couples and situations. But if there's any questions anybody has or would like any further information, they can just feel free to call me, Kathy Miracle, at Family Service Association of Northeastern Pennsylvania at 570-823-5144. So thank you and have a great day.